Guys, today we are going to discuss about hypersensitivity reactions. Hypersensitivity reactions can be remembered by this mnemonic acid. A means anaphylaxis, C is cytotoxic or antibody dependent cellular cytotoxicity, I is immune complex mediated as antigen antibody complexes are mediating this type of hypersensitivity. D is delay type or cell mediated immunity, which is type 4. So what is hypersensitivity? Means in response to small allergens, our body will produce some type of response, some type of allergy. This is known as hypersensitivity. So it may be genetic reasons or anything. So let's get started. What is type 1 hypersensitivity? As we have discussed, anaphylaxis. So normally in this type of hypersensitivity, IgE antibodies are involved. Sensitized B cells means plasma cells will secrete IgE antibodies. These IgE antibodies, Fc portion of this IgE will get attached to the Fc receptor which is present on the mast cell, and mast cell degranulation will occur. Order first we have to understand by how these allergens are sensitizing B cells and what are the allergens which are causing this hypersensitivity, type 1 hypersensitivity in different individuals. These allergens may be food. Food means like anything. Some people may be sensitive to peanuts, some may be sensitive to fish, like that. Plants, some fruits, maybe hypersensitive to someone, like pollen grains and proteins like vaccines, like drugs. Some drugs may causes hypersensitivity reactions. Insect bites means venom of bees bite and wasp. These all and remaining others may causes type 1 hypersensitivity. Now coming to what is PK reactions. Prosnitz and Hausner first demonstrated the antibody in the serum which is responsible for the allergy. This is known as, first they used to call it as PK antibody as they discovered it, or regionic antibody. Later it was named as IgE antibody. So we have to demonstrate how this PK reaction which is occurring. I will see. Serum of the infected person means in that serum what is there, IgE antibodies are there. This serum with IgE antibodies which is injected into normal persons. Then what happened? Vein and flare response occurred. What is vein and flare response? Normally it occurs within 3 stages. First one is it begins with the appearance of red color appearance, erythematous area at the site of the injury, which is followed by the development of flare response. Means full erythema will occur and vein occurs. Vein means condition with the swelling under the skin due to the leakage from the surrounding capillaries. So let's understand the mechanism of type 1 hypersensitivity. Normally when antigen is entering into our body, our immune system reacts to it. Our antigen presenting cells will recognize that allergen or antigen, and it will process it, and it will process, and it will say to the TH cell by means of TH cell, we know no CD4 marker. By CD4 marker it will recognize the allergen which is processed by the antigen presenting cells. Then the CD4 cells will get active, and they will be differentiating into TH1 and TH2 cells. Mainly we are bothered about TH2 cells. TH2 cells which have the MHC2 marker, we know that CD4 marker, it will release interleukin 4. By means of interleukin 4, these B cells will get differentiated into plasma cells and memory cells. Memory cells means this will be memorizing if second attack of same type of allergen which is there, then these will produce intense response. So they will recognize the allergen. Oh, it had already previously came, now again it came. So we have to show immediate response. Like that, memory cells will recognizing this allergen when it comes twice. So these plasma cells, what these plasma cells will do? These plasma cells will produce antibodies. These are IgE antibodies specifically to this type 1 hypersensitivity. These antibodies, they will get attaching into the mast cells. mast cells, they will be Fc receptors as we saw here. These are the receptors which are present on the mast cell. These are the IgE antibodies. They are getting binding to the Fc receptors present on the mast cells. Fc portion is binding. Then what will happen? This again, if the allergen is re-exposing, means again it is coming, then this mast cells degranulation will occur. These substances are histamine, serotonin, like this. These substances are primary mediators. This will cause smooth muscle contraction, blood vessels vasodilatation due to increased endothelial permeability, and platelet granulation, agranulation will occur, and sensory nerve endings, sensory nerves will be stimulated, and pain occurs. Eosinophilic secretion, eosinophils will leads to production of allergy. So there will be two phases of this type 1 hypersensitivity. One is sensitizing phase, another one is effector phase. We had already discussed this sensitizing phase. Sensitizing phase means up to this release of means B cells will be getting differentiated into plasma and memory cells. No, after that these plasma cells are releasing the antibodies, secreting the IgE antibodies, and these IgE antibodies are binding to the mast cells. Up to this is sensitizing phase. After effector phase is where degranulation is occurring. Degranulation means after this IgE gets binding to the mast cell, the mast cells will secrete serotonin, histamine, and some other secondary mediators will also secreted by these mast cells. They are prostaglandins and leukotrienes. What prostaglandins will do? Prostaglandins will cause vasodilatation. Leukotrienes, as we know, LTB4, which is major leukotriene we had seen. Okay, and these pharmacological actions will be on smooth muscle contraction will occur, and in the blood vessels, vascular permeability will be increasing, and vascular dilatation and increased blood flow. So we'll see it as erythema, redness will occur at that area. So what are the symptoms we will see in usual? So breathlessness will occur because of this contractions. If this contraction will occur at the bronchi, what will happen? Bronchoconstriction will happen. So severe breathlessness will occur, and hypotension. Hypotension, why? Because of increased vascular permeability and vasodilatation, hypotension will occur, and sometimes it is leading to shock. Okay, because less blood flow will occur to that of the tissue, and shock will occur. Okay. So what are the manifestations? Early manifestations, late manifestations. These early manifestations are systemic anaphylaxis, localized anaphylaxis. Systemic anaphylaxis, severe dyspnea, irregular breathing, hypotension, vascular collapse as vascular dilatation is occurring. These allergens may be bee wasp and antihistamines. These will release the venom, and some drugs, antitoxins, seafoods, and nuts. These are all the allergens which are causing this systemic anaphylaxis. So what we should do? What is the treatment of the systemic anaphylaxis? Means drug of choice is epinephrine. Epinephrine should be given intramuscularly, one is to 1,000 uh, in quantity. We have to in dilution. We have to give this epinephrine. We have to give it IM. IV is dangerous. Okay. Localized anaphylaxis. If we are giving IV, we have to dilute it more 10,000 times. Okay. Localized anaphylaxis, or we will call it as atopy, allergic rhinitis, or hay fever. In this, secretions will be increased from the conjunctiva, nasal mucosa, and we will get like severe cough. These all will be presenting in the allergic rhinitis. Asthma may be allergic or intrinsic due to the entry of pollens or something. We will get asthma, which is allergic condition. Intrinsically, due to the genes, due to that heredity, we will get intrinsic asthma. Food allergy, as we saw earlier, any peanuts also may cause allergy in some individuals. Atopic dermatitis, localized dermatitis will be occurring, and some drugs may produce allergy. These are coming under a localized anaphylaxis or atopy. What are the late manifestations? Late manifestations means after some hours of exposure to the allergen, like 4 to 6 hours later, some inflammatory response will occur. What is inflammation? We know. No, what are the five cardinal signs of inflammation? We all know. So this response will be lasting up to 1 to 2 days, and this will leads to finally tissue damage will occur. Then what are the mediators of this inflammation? Means interleukin 3, interleukin 5, interleukin 8, and eosinophilic factor, cellular factor, and neutrophilic cellular factor. Okay, cytokine factors. So these mediators will be releasing along with the cytokines. So how what are the major cells will be recruiting to the inflammatory site? Means eosinophils, neutrophils, which are predominantly recruiting. Normal macrophages, lymphocytes will also recruit, but in case of chronic they will recruit. Mostly 30% of the total inflammatory cells will be eosinophils and neutrophils. Eosinophilic influx, how it is favored by eosinophilic chemotactic factor. So chemotactic factor, interleukin 5, and GM colony stimulating factor. This eosinophilic express the Fc receptors for IgG and IgE, both receptors. For both IgG and IgE antibodies, Fc receptors will be expressed on the eosinophils, and these will IgG and IgE will directly bind to this eosinophils in response to allergens. Okay, release of granules will occur from the eosinophils, and chronic inflammation of the bronchial mucosa, we will see this release of granules from the eosinophils, and it will cause the persistent asthma. So what is neutrophilic infiltration? Neutrophilic infiltration will be induced by neutrophil chemotactic factor and other cytokines like interleukin 8. Various mediators will potentiate this tissue damage, and some thickening of the basement membrane will occur. What are the factors? As we saw in intrinsic asthma, genetics are involved. So genetic makeup and allergen dose. High dose of allergen is exposed, so more the response, more intense the response will be. TH1 and TH2. TH2, as we saw, interleukin 4, 5, 3 interleukins, it will sensitize the B cells, and B cells will be getting differentiated into plasma and memory cells. TH1 by interleukin 1, it will show the response. And so detection, how we will detect this means skin prick test. And skin prick test and total serum IgE antibody we have to see by enzyme immunoassay. Okay, skin prick test means sometimes we have to inject so many allergens into the normal person, and we have to see whether there is any allergy is producing or not, but this is not that accurate. Okay, so intradermally we have to inject these allergens, and we have to see the response. Or allergen specific IgE, this is we are doing for now. Now I said no, we have to inject allergens intradermally, and we have to see the response for this. For skin prick test, we have to see whether the arrhythmia is occurring or not. Okay, multiplex immunoblot assay, it uses the nitrocellulose coated with 54 allergens. Okay, fluoro enzyme immunoassay, which is available as immunocap assay, automated immunoassay system, high-tech 228 plus system, anti-ccd absorbent IgSA, which detects the Ig absorbing a non-specific anti-ccd IgE against cross-reactive and cross-reactive antigens, and radiometric assay, which is called RAST, radioallergic sorbent assay, which is now is in use. So what are the treatment? We have to first prophylaxis, we have to avoid the contact with the allergens, prevention. So hyposensitization, monoclonal Ig anti-IgE drugs. So some drugs which are used to treat the type 1 hypersensitivity, like antihistamines. Antihistamines, they will block the H1 receptors on the target cells. Okay, so histamine release will be stopped. And epinephrine will stimulate the CAMP production, and it will prevent the massive degranulation. It causes dilatation of smooth muscles. So that's cortisone. Cortisone, it will block the conversion of histidine to histamine. Histidine will be converted into histamine and COOH group will be removed. And this blockage will occur, so histamine cannot stimulate this mast cell and sensitize the mast cell. So that CMP levels in the mast cells will be reduced, and the histamine can't produce the allergy. And theophylline will prolongs the high CMP levels in the mast cell. Chromoline sodium, it will blocks the calcium influx into mast cell. So if calcium influx is blocked, then no release of the histamine will occur appropriately, and no smooth muscle contractions, no vascular contractions will occur. Okay. Okay, guys, that's it for today, and I hope you enjoyed this video. And majorly, mostly, we have to see for the mechanism of action, how this type 1 hypersensitivity which is occurring, what are the mediators, and what is the treatment. So, thank you. That's it, guys, for today.